I do get quite a bit of people, even friends that have said, oh, it's not true, it's not real. And I'm like, I would love to give you a tour in my unit and show you that it really is real. Like it's real. These people are here, they're sick, and they're dying. And I always try and remind them, make sure you're wearing a mask, make sure that you're practicing you're washing your hands and, just keeping your distance. The nurses, the doctors, our supervisors, our managers, everyone's always checking in on you, always, trying to do research, update us on the latest things. How can we make these patients better? Trying new things with them. The teamwork is great. The support is great. They're always checking in on us, making sure that we're emotionally and physically able. And it's always nice because they rotate us through the unit as well, so we're not always just in the unit. A typical day at me coming home from the COVID unit, I have a daughter that is very affectionate, wants to give you a hug, and I have to wait and let her hold on, don't hug me yet, which is really hard for me to do as well. You can't give me a hug as soon as you see me, so I have to go and change out of my scrubs, jump in the shower, just, because I don't want to pass down this to my child. It's tough. My message is don't do it, stay home. It's not worth it. Again, wear a mask, practice, washing your hands, practice your distance. It's not worth it. You're going to potentially, infect someone if you don't even know if you're a carrier. And would you rather be, stay home for the holidays versus being in a hospital bed alone? It's not worth it. Particularly patient, you see them, when you see them walking into the hospital and they're still talking, and we go from a non-invasive procedure to having to put them on a ventilator, and then just watching them deteriorate. It breaks my heart. And being in the field for this long, it's never easy. It's never easy. And watching the family kind of coming in saying their goodbyes, that one kind of it really broke my heart. It's not easy. The teamwork is great. We work really well. We're close together with the ICU nurses as well. So, the communication is there. The teamwork is there. We're always just, asking each other, how can we help this patient? How do we make them better?
So as a respiratory therapist, we see death. It's part of our jobs. With COVID, it's a lot different because you'll get multiple family members that come in, and a few of them might not make it out. So that's tough to handle. You'll also get couples. We've had couples celebrate their anniversaries here, and it's sad to see. I forgot where I saw it, but assume Thanksgiving is better than a ICU Christmas, and I think that's true. I mean, if you can talk to your families through phone, through Zoom, through FaceTime, and avoid seeing them in person, you're reducing the chances of getting COVID. So I think Salinas Valley Memorial Hospital is doing a great job when it comes to taking care of our patients. I think we're doing everything we can to help them, and at the same time, I feel safe, and I feel like we keep the rest of the patients safe while we're doing that with COVID patients.